So I'm David Roodman, and I'm at the Indiana University School of Medicine, and today we're going to discuss optimal treatment of myeloma bone disease. The questions that arise with when to start treatment, how long to treat, and who to treat. Any patient with active myeloma should be treated with bone-targeted therapy, either bisphosphonates or denosumab, which has just been recently approved for patients with myeloma. This is regardless if they have skeletal lesions or not, either on skeletal survey or other modalities. How long should you treat the patients? Most of the studies to date have been done for 2 years. So the current guidelines from ASCO and other organizations are to treat for 2 years, and then it's up to the physician's discretion whether it should be done. People are now looking at whether after the first year of treatment, which is done on a monthly basis with these agents, whether you can extend the treatment so that based on their disease status. And most people are now looking at the idea of patients who are in complete remission or very stable, near complete remissions. You can expand the interval to every 3 months. Now this is only for bisphosphonates. No one has looked at expanding the interval in denosumab to date, and therefore it's still open to question. The question then becomes, what do you do after the 2 years? And most people are now expanding the duration of bisphosphonate therapy. If they're in very good complete remission, that is minimal residual disease, negative complete remission, they may just follow these patients because bisphosphonates will stay in your bones for up to 10 years. The question that is often raised is, what do we do about the patients who have to have dental procedures on these drugs because of the concern of osteonecrosis of the jaw? The ADA guidelines now suggest that you can make that decision based on their clinical status, not whether they have bisphosphonates on board or not. Other recommendations have included stopping bisphosphonate therapy for a month or two before getting their dental procedure thereafter. What's most important is that you do dental prophylaxis prior to starting these agents, and then do good dental monitoring every 6 months. And this has markedly reduced the incidence of osteonecrosis of the jaw in these patients from about 10% to down to 2%.